cystoscopy and what it is and what to expect. Cystoscopy is a bread and butter tool of urologists. And what it allows us to do is to see inside the lining of the bladder and the urethra. We can see and learn a lot about anatomy using cystoscopy. Cystoscopy, the word broken down, means cysto, which is the bladder, and oscopy, meaning camera. So simply put, it's a camera looking into the bladder to tell us about your anatomy or to answer a question. It's commonly used to diagnose obstruction and tumors or bladder cancer. Cystoscopy is an outpatient procedure performed in our ambulatory surgery center. It requires no anesthesia, so you can drive yourself and you can eat breakfast. Cystoscopy is a 3 to 5 minute procedure. Most people describe cystoscopy as worse in their head before they get it done than the actual procedure, and that's the reason why I want to talk about it today. The idea of a cystoscopy is very stressful for a lot of people because they don't know what to expect, and that's why I want to talk about it today. You'll drive yourself to the surgery center after eating a lovely full breakfast because there's no anesthesia. You'll check in and the nurse will fill out the customary paperwork and take your vitals and address any other concerns that you have. You'll then need to get undressed from the waist down because that's where the bladder is. We'll provide you with a gown to keep you as modest as possible during this procedure. The nurse will then clean you off with some soap to keep the procedure as clean as possible. And then the doctor will come in, say hi, answer any questions that you had, and then begin with the procedure. The camera used for the cystoscopy is a long catheter with a digital camera attached, and it's put on a digital screen so that you can see, as well as the doctor can see, what's going on. Looking in the bladder takes about 1 to 2 minutes, and we'll talk you through it the entire time if that's what you'd like. Once you're done, we'll let you get dressed, and then you leave. The whole experience is less than a half an hour. Cystoscopy should not be painful, but they feel wet because of the water used to allow the catheter to go in, and it feels like you have to urinate. We do use lubrication in order to guide the catheter in, but no other anesthesia is needed. This is a cystoscope. It is a digital camera that looks like a long catheter and is attached to the digital scope, which projects it onto the screen so both the doctor and you can see what's going on. Water is placed inside the port, and it may feel like you have to urinate while you're undergoing the procedure. This procedure is quick and takes less than 2 minutes. The whole time you're here should be less than a half an hour. Side effects of cystoscopy are minimal and rare, but can include mild pain, burning with urination, the urge to urinate, or a urinary tract infection. If you have any concerns in the days following your cystoscopy, please call our clinic to discuss them.